Hi, Dr. Pelto here. I had a question of a patient of mine. She came in recently. She had all four edges done with something called a matrixectomy. And the question is, why is only one border red? So let's look at her picture here. So don't worry about this white stuff. She has a little nail polish on her nails. She's a teenage girl. And this little white here is just I think it's a shadow from the picture we took, a little like almost a glistening or a reflection. But if you look at the edges, I did all four toenails. So let me explain. So I did this edge, this edge, this edge, and then this edge. So all four toenail edges. Why? Because she had chronically ingrown toenails. And one thing I do for girls, for females normally, is I don't take a big portion on the edge. I try to do only 1 to 2 millimeters to get that out, because I find if I take too much, it kind of looks like a diving board. As you can imagine, a diving board would be very narrow, and then all the girls, they get mad at me. So I don't do that anymore. I try to take, if anything, I take too little, and there could be a problem. And this is exactly what happened. So these two look fine. There's a little bit of swelling. There's a little bit of drainage. This one, do you see how it's red and it's really swollen toward the tip? Well, what happened is when I took out a little bit, this area swelled up because of the sodium hydroxide that I put in there. And the swelling caused it to dig into the edge. So when I saw this patient at the 2-week follow-up, she had this swelling and redness. This is not infection. I want to be clear. What this is a reaction from the swelling and that digging into the edge. So I simply trimmed it back, and that was able to take care of that. And I could see there was some injured tissue in there. So this is one of the treatment options for a chronically ingrown toenail, called a chemical matrixectomy. In our office, we use sodium hydroxide in there, and that does a very good job, and the nail won't grow back. What are the couple of risks of doing it? Well, one would be a little piece, a spicule growing back, or an infection, but this, once again, is not infected, and this is how we treated it. If you guys found this helpful, I'm going to put a little link here over to the side to something called a foot treatment toolkit. Basically, it's like the top 30 conditions that I treat, with kind of how to treat them on your own, and when to know that you should be seeing someone. So all the resources right in that foot treatment toolkit. And there's a couple of other videos I'm going to put here on ingrown toenails. Hope this was helpful. Please ask any questions underneath the video so I can answer them. Okay, great. I hope this was beneficial for you. And until next time. Okay, thanks.